So greetings, everyone. My name is Matthew Calandrillo. I am a clinical director at large with the NCCE, and we have a number of our board members on this call. We'll kind of be assisting throughout this webinar. This is a first for us. We are excited. We've been hearing this calling for resources, and this is an opportunity to kind of bring it directly to everyone. Thank you for joining us on this lunchtime for those of us that are at a lunchtime kind of hour. Thank you for taking the time to kind of do this, and we hope to bring just straight value to the content that we'll be delivering today. My partner in crime for this afternoon is Lori Gussman. She also is a board member of the NCCE. So I'm going to pass the baton to her. She'll talk some of the ground rules. So you'll hear us for a few minutes, and then we'll go directly to some breakout rooms with hopefully some useful content you can even start as early as this afternoon. So Lori, to you.
Thanks, Matt. I'm Lori Gussman. I am part of the board of the NCCE. I'm an academic director at large. I am also part of the clinical education team at the University of Miami in Florida. Yes, we have a team of clinical educators, very lucky. Our clinical partner at UM is the University of Miami Hospital and Clinics. And I'm highlighting this today so that you better understand the makeup of the NCCE. I know a lot of you are members and you know that, but I think it's important to emphasize that our membership is made up of clinical education institutional pairs. Okay, so my job right this moment is to go over a few ground rules. If you could all please stay muted during the hour, that would make things run a lot smoother. If you do have questions, which I'm sure you will, because we really want to get everyone involved in the dialogue with what's happening today, please do use the chat feature so that you can type in any questions, any comments, and we will have folks in the room that will synthesize those questions and present them to our speakers. The speakers will have 20 minutes each. Yes, in a few moments, we will go into breakout rooms and they will have plenty of time there to answer your questions. At the end of this, at the end of the two presentations, we will reconvene for 5 minutes approximately in the big group. And we really want you to come back because we have more things to share. You don't want to miss this. Matt, you can advance the slide and take it away.
Well done, Lori. Oh, sorry, guys. So we've been eager to start to bring direct content to members of just the ClinEd community, and people have been hungry for it for a long time. And we've been talking at length about a resource hub, a place to start to put this content and this information. And that's still in the works. That's still the goal of the entire piece, is trying to bring resources to as many people as possible. This was born of an idea of, let's stop talking about it. Let's do it. Let's bring some of this to action. So our plan is to bring value and bring resources during these types of webinars from lots of different individuals within the ClinEd community. Two things we really want to stress today is that it's easy and we want people to be involved. Listen to these presenters today and have your brain kind of twirling as to, you know what, we do something that's pretty interesting, or this process seems to work for us, and perhaps it would be valuable to bring that forward to people on a national kind of stage. So at the end, Lori and I are going to provide a couple of methods to get that information out to us so that we can reach out and potentially do a future webinar with some of the content that you have. And then for today's pieces, we want the information to be practical. We want you to be able to hear a short little presentation about what some other programs are doing, that it might be innovative, or ways in which they provide their ClinEd. And then how can you mush that into your own system? How can you start to use this in a workable sense within your own system? So really want it to be easy to be able to bring content forward for other individuals, as well as practical. We want this information to be able to be utilized. So we are excited that this is the first of what we hope is many webinars that start to share ClinEd resources.
Great. I don't know if we've mentioned this, but the title of our resource sharing is Alternative Learning Experiences During Clinical Education, and I have the pleasure of introducing our speakers. I hope this slide kind of highlights what a partnership looks like. Yes, our speakers are partners in crime, as they say. Dr. Jen Bell, who is the young lady on the right of the slide in that sheet, black and white, is the director of clinical education, and she's a clinical assistant professor at the University of Montana School of Physical Therapy and Rehabilitation Science. Dr. Bell and the clinical education team created an innovative clinical education model in which students in their second and third year spend their mornings in the classroom and labs and their afternoons in the on-site clinic. In the clinic, students work with faculty to treat patients and deepen their understanding, of course. And in other words, it just sounds like heaven to me. They work in a collaborative learning model. In this setting, Dr. Bell developed the tool that she will be presenting to you, and I'll let her share that when we get into our breakout rooms. Our second speaker, or also our speaker, highlighted there in living color, is Dr. Jacqueline Carson. Dr. Carson is a CI and SCCE at the on-site outpatient neuro and ortho physical therapy clinic at the University of Montana. Can you imagine? She's also a member of the NCCE board as a clinical director at large, and we are so lucky to have her, so grateful. She currently works with students in the clinic in a 4-to-1 model, 2 afternoons a week with the second and third year DPT students. From her work in this model, she created the tool that she's going to be presenting. So this is wonderful. It's designed to engage students in identifying their thought processes through clinical reasoning and decision making. So I think with that, there is a document, a tool that Jacqueline needs to share, and I believe you're going to be able to find that in the chat box when we break out into our rooms. And with that, I think we are ready to break out into our rooms. I would like to make sure that our speaker is here, and I see her, Dr. Bell, and I have 2 folks that I would like to introduce to you. I introduced Dr. Bell, and she'll be speaking in a moment, but I would also like to introduce the folks behind the scene who will be monitoring the questions and helping us with timing and all of those kinds of things. So if you would, Dr. Myers, Dr. Katie Myers, she's the DCE, and of course a member of the board, the DCE at Duke University. So Katie, if you can wave at everybody or say hello.
Hi.
So great.
Hello.
And our other NCCE board member that will be assisting us today is Colette Piantock. Colette is the manager of education and SCCE for Memorial Hermann Sports Medicine and Rehabilitation, and that's in Houston, Texas. So Colette, if you could say hello.
Hi, good morning and good afternoon, I guess.
All right.
Since we're going across the country.
We're going across the country. And then I believe it's my job right this moment to share the screen so that Dr. Bell can get started. And talk to me, Dr. Bell. Did I do the right thing?
Yep, looks good to me.
You just let me know when you'd like me to advance.
All right, sounds good. Well, welcome everyone. Thanks so much for being here. I'm really excited to present this tool that we've been using in our clinic that's on site. So it's a diagnostic clinical reasoning worksheet. Go ahead, Lori.
Certainly.
So there's a little image of it there at the bottom, but it's a worksheet. So you can print this out, give it to your students, or you can share with them as a Word document. And so the way we use this is we have the students use this based off of an upcoming initial evaluation that they've been using, but we can also kind of brainstorm ways to use it maybe on like a reevaluation, that type of thing. And really what the purpose of this is to guide the students to formalize a kind of differential diagnosis list that will help them in that initial evaluation to come up with the actual diagnosis for their patient. So we'll dig in more to the actual tool in a minute, but Lori, on the next slide, let's just talk a little bit about kind of why we decided to create this tool. And so, Lori, can we go to the next slide?
I am so sorry. For some reason, I am having a bit of technical difficulty here and cannot get to the your screen.
Well, so with this tool, we really wanted to help students get through that diagnosis process, because we hear from our students that that's a really hard thing for them, is to kind of sit down with a patient and, kind of reason through a diagnosis that they come up with. And we also wanted to kind of work on those clinical reasoning skills around developing that diagnosis. What we've seen, we looked at some of the research from like Bolin in 2006 and Doty and McAteer in 2002. And what we see is with expert clinicians, they start to develop this this pattern recognition when they're going through a diagnosis. And so what we want to do with these novice students is help them to be able to do a better job with their data acquisition during that initial evaluation, kind of come up with this problem representation and identify a pattern to get to an appropriate diagnosis. And so the learning objectives with this tool are that the student will be able to select some appropriate diagnoses to put on that differential list with using this tool based off of patient demographics, and that they're able to describe kind of what that presentation would be. And if we can go back a slide, Lori, that'd be great.
Going back or?
That's forward, so going the other way.
I'm so sorry.
Okay. So we're on slide 3. Yeah, right here. Great. Oh.
Still one too many.
Yeah.
Sorry.
And so for each of those diagnoses, we want them to be able to, think through what the patient would look like, and then ask good questions. One more. Yep. Ask good questions during the evaluation to compare the patient's presentation to what they came up with on their differential diagnoses. And then one of the things that I teach here is I teach our clinical medicine differential diagnosis medical screening course. So I always ask the students to include a medical condition, even something like a rheumatoid arthritis or other systemic arthritis in there, so that they're thinking about, I also need to rule out like a medical condition that could be mimicking the patient's complaint and mimicking a musculoskeletal condition. And then they're able to synthesize the data from the worksheet and the patient exam to come up with the diagnoses. Right, next slide. So kind of the steps in this. So it gets assigned to the student. Now the student may decide that they want to use this tool, so they can, be student directed in the decision to use this. The CIs may decide like, okay, we have this, this downtime. Maybe there's a cancellation. Maybe there's not a ton of patients right now. Maybe with COVID, I need to see a patient and a student needs to, be doing some self-directed activity. So the CI could decide to assign it to the student. Or also, I know there's a number of DCEs on this. As a DCE, you could ask your students, okay, I want you to do 3 of these during your clinical experience. And so then the student completes it. Now this can happen in the clinic. So again, if you have that downtime when you have, you don't have a patient for your student to work with, they can work on this there. They can do this at home in the evening before that initial evaluation. It can also be completed independently. So the student is working on their own, or it can be done collaboratively. So in our clinic on campus, we do a collaborative model where we have students working in pairs, and then each CI has 2 pairs of students. And so they could work with their student partner or with another student that's at the facility to work through this. And they could obviously work through this with you as well. And we'll talk about what that looks like. And then it gets reviewed with you and the student. And so you can review this at each step of the process, but then you can also, as you're kind of pre-briefing with your student before they go into that initial evaluation, you can talk through what are those diagnoses that you're looking for, what is it going to look like, what questions are you going to ask, what test and measures are you going to use to be able to rule in or rule out these these diagnoses on your differential. And then I'll show you when we look at the tool, I have one that's kind of filled out, how we use it again during the evaluation. So go on to the next slide, Lori. All right, so I know you're all thinking like, especially as CI, like how much work is this for me? This can be completely self-directed by the student. So you can assign it, the student completes it, and then it just like guides that discussion with you and kind of helps the student be like more concise in their chat with you before they go into that initial evaluation. Maybe for that 3rd year kind of final clinical student, they're just using this on their own completely. But it also can be collaborative, again, with a PT student partner, but also to, I was thinking about like in those great interprofessional outpatient peds environments where you might have an OT student and a PT student, and they might be seeing the same patient for a new evaluation. They could work together to do this and to kind of think about like how are you thinking about this patient? What are you looking for? What am I looking for? So again, it could be a tool for interprofessional collaborative practice as well. All right, so on the next slide, I'm going to show you the full tool. So what we have at the top is, oftentimes in outpatient ortho and neuro in our clinic, the patient calls and schedules, and we know there's an evaluation tomorrow, and I know the patient's age and gender and kind of the complaint they told our front desk person when they scheduled. So like, I need to come in about my knee. Maybe in some settings you have some more information, or you've gotten the patient has submitted their intake paperwork in advance of the appointment. So that's kind of what we're working off of for this worksheet. And so then we go through and we come up with possible diagnoses based on the information we have, how it should present if it is that diagnosis. And then in the patient symptoms, what we do is actually after doing the subjective and the objective, they can fill in this spot with, okay, so my patient did have these symptoms of this diagnosis. And then they can, at the end, determine like, okay, it's high probability that it's this diagnosis or it's low probability, right? So they are then comparing their patient symptoms with this kind of pattern, this presentation pattern that they've come up with. So Lori, on the next slide, what we'll see is here's one filled out, right? So a 26-year-old woman is coming in with right hip pain, right? And so I assign this to my student and they come in before the evaluation and this is what they've completed. And so again, I like them to have like a medical thing on there that could be, referring pain to this area. And so for this, we have FAI, OA, a labral tear, and ovarian cyst. So they describe their typical presentation. I didn't do a ton here, but I like for them to have like, what are they going to hear in their subjective, as well as like test and measures that would be positive or negative with this. And so for me, right before we go in for the evaluation, or maybe first thing in the morning, I talk through this with my student. And in this situation, I'd say, well, tell me more about why you put osteoarthritis on here. What are you thinking about with this patient? We know it's a woman. We know she's 26. Why did you put OA? And so I'm trying to figure out like, what was their clinical reasoning there? Because I wasn't thinking OA for someone of this age. And so it's a way for you to kind of facilitate that conversation and maybe help them kind of refocus and say, oh, you're right, maybe it wouldn't be OA. Maybe I need to put something else on here. So, this can be used with any level of student, but obviously our expectations are going to vary a lot. So, I can imagine, so our students go out on a full-time clinical experience during their first year, at the end of first year. And I can imagine with those students, they might be filling this out with more direction from their clinical instructor. So they may not be able to come up with that differential diagnosis list. So maybe you give them that list and then they have to research and fill in what that presentation would look like. Then they're watching you do the evaluation and they're filling stuff in and working towards a diagnosis, kind of working along with you. Versus that third year student, again, towards the end of the experience, you assign it and they, run with it and work on their own. I mean, it can be used in a variety of settings. And so I kind of wanted to kind of kick it to everyone who's participating in this. So I gave an outpatient ortho example. I can also imagine, I want to hear from you, like how you could use it in the settings that you're in. I was thinking about and had talked with Jacqueline a little bit about neuro patients, because neuro is her focus. And you may have a patient that is coming in and all you know is they're coming in for a stroke. And so in the neuro setting, you could outline different, like, okay, well, what would, right hemiplegia look like, left hemiplegia, what else would I expect to go with it? And so you can start to think about it that ways. But, now, do you all have any questions or ideas on how you might, use this in your setting?
I might remind you, Jen, that we did ask everybody to keep their mics muted. So these questions or how they would use the tool will show up in the chat box. And I'm going to go ahead and stop sharing the PowerPoint. Or unless you want me to go back to anything that kept dragging us through.
Yeah, so there's a question here about how does this relate to movement systems diagnoses? And so you could certainly, if that's like the system, the way you're thinking about working with your students, then you could use those different types of diagnoses. Is it extension? Is it flexion? You could put those in as your differential. And then what would that actually look like, in the upper extremity or the lower extremity? So you could use it that way. Other kind of questions, thoughts, comments?
Katie, are we seeing anything in the?
Yeah, there's one comment in the chat, and I don't know, Lori, if we want to just let people unmute themselves and comment. I think that would be okay as well at this point.
Thank you.
There's a comment from Ralph that this could be used by students for patients with dizziness and balance disorders.
Yeah, definitely. So, you have that patient with that dizziness complaint. So what are potential, causes of that, and how is that going to present differently in your test and measures? Yeah.
I see
Robin?
a hand.
I have a
Robin?
comment. Yeah.
Yes.
Sorry.
ahead.
First of all, I love this. I think that's great. What a nice way to, it's so hard to sometimes objectify some of these very subjective assessments and thought processes. But I could see, I work primarily in academia as a DCE, but we do a clinical readiness simulation assessment. I can see using this as part of our clinical readiness tool with the simulation that we do. So I think it could definitely be used even just to determine readiness. So I'm excited to get this tool. I think this will be very easy to implement. Thank you.
Yeah, thank you. And I will, I think I can only put a PDF in the chat, but I think it'd be a lot easier if you have the Word document, because then students can actually fill it in. So I'll work with, the NCCE team to get a Word doc version out to everyone.
As a matter of fact, Jen, we will be able to do that. We're going to tell people where they can access both your PowerPoint and your tools at the end. So.
Yeah, so it looks like there's a question about any diagnostic testing that maybe the patient has coming into this. So, I could put that up in like that other box up at the top of the tool of like other information you have prior to seeing the patient. But sometimes it's like during that interview that you're talking to the patient, like, oh yeah, and I had, an MRI or, that type of thing. And so then that goes into kind of that your patient's presentation part of it. So, the data that you've gathered. And I would say like, oh, they, so for my example, if they've had an MRI that showed a labral tear, then I would put that in on the labral tear column under the patient presentation as, positive MRI for labral tear, would be one of my findings.
Any other comments, questions?
There's a comment from Amanda that seems like this would be a great place, especially for the beginner mid-level student, compared to the EIM flow sheet that some of her clinicians that she works with use.
Yeah, I think, thinking about that beginner student, this could be a great way for them to try to figure out what it is you're thinking as you're going through that evaluation, right? So sometimes they're like, oh, well, why did she do that test? Well, if they've already come through and, kind of come up with tests and measures that go along with these different diagnoses on their differential, then it can help them to start to kind of essentially try to figure out what it is you're thinking as you're going through that evaluation, and that maybe they're not doing those skills yet, but they're in the eval with you. Yeah. So one of the thoughts that I had, and I wanted to get you all's perspective, any thoughts on using this in acute care, or maybe that setting where you have a diagnosis?
So it looks like comment about maybe using it more for the social psychological factors beyond differential diagnosis and subjective information, accounting for that. And then for discharge recommendation.
Yeah, so where do we kind of capture those social, psychosocial, social determinants, information in this tool. That's certainly like a piece of it. You know, I didn't include that specifically around like getting to that diagnosis, but certainly kind of that next step of how do we, you know, actually come up with that plan and implementation, and what are those, you know, the patient values, and how does that impact this? You know, certainly I can imagine a situation where, you know, the student does a really great job of coming up with all of this, and they go in with a patient and none of it applies, right? And so then at least they have the ability to say, okay, actually nothing on my differential is appropriate for the situation that, you know, is in front of me. You know, one of the thoughts I had with acute care is, you know, oftentimes we have like, you know, the patient's diagnosis going into it, but starting to help that student kind of figure out like, what is the patient going to actually look like, right? So, you know, what's the situation going to be like when I go in that room? And even kind of thinking about like, okay, you know, what if mobility is, you know, they're having issues with walking, or maybe they're up and walking, but they're dizzy, or, you know, those types of things. So kind of starting to think about, but how is this patient, what are the possible ways they could present, even though I know this diagnosis?
Yes, Jen, there's a couple comments around using, this could be helpful in acute care around the kind of seeing the big picture of all the factors influencing that patient's care, but also I think, as you were just saying, linking impairments to function and really starting to think about what are at the impairment level, what might you see, and how might that translate into functional, you know, mobility deficits or activity limitations.
Yeah, definitely.
I think we will be switching speakers in just a few moments.
Yeah,
So
and,
I want to
you
thank
know,
everybody for the contribution.
yeah, you know, one last thing I'm just thinking about with, you know, the psychosocial components and like in acute care is, you know, you could certainly use this instead of lining out diagnoses, but like potential like issues that need to be navigated, right? So what is the home situation? And, you know, what does their support network look like at home? What do, you know, assistive devices? So there's different ways that you could, you know, use that and start to classify those types of things. Well, I appreciate everyone joining and providing like good feedback and comments, and we'll definitely get this tool out to everyone to use.
Jen, thank you so much. That was great.
Right.
Thank you.
Thank you.
Thank you.
Bye, everyone. We'll see you back in the main room in a few minutes.
You bet.
Lori, just to clarify for everyone, we're staying here and another
Yes.
speaker's coming in.
Thank you, Katie. And should we keep with letting folks ask questions instead of trying to type or both?
I think, why don't we, if they have questions during the presentation while the speaker is speaking, they can chat and put them in the chat. And then if I think if people want to unmute, maybe if there's time for questions after, that might work better.
Thank you.
Okay.
And I don't know if we have Jacqueline with us yet.
Nope, I don't think she's popped in yet.
All right.
Okay, I'm always good at a gap filler in terms of conversation.
Go for it.
And so I just want to say that I love your background, Lori.
Thank you. And you know where that came from.
I'm guessing that was a Matt original. And I just want to thank everyone for joining us. We're really excited about this. And I can't tell you, our planning committee of Matt, Lori, who you met in the initial session, and then also Susan Tomlinson and Jacqueline, who's going to be our next speaker. We're just, the four of them were integral in getting this planned and trying to make this a fun, easy way of sharing resources so that we can, again, continue to network and share the resources that we're all coming up with. So kudos to our planning committee.
Thank you, Janice. And look, just in time, we have our speaker ready to rock and roll. Jacqueline,
yes,
welcome.
Thank you. Oh my gosh, Lori, I love your background.
Thank you. And as I said, you probably know where it came from.
Oh my gosh.
I am going to share my screen now so that you can get started. And I'm sorry. I thought I had this ready to go. Share. Okay.
All right. Thank you, Lori.
Thank you, Jacqueline,
Yeah.
for your patience.
Yeah. Oh gosh, of course. So I'll warn you, I tend to get ahead of myself when I teach, more or less this too. So if I get ahead of the slides, I apologize. And so I put together a patient case worksheet for my students. Again, I'm Jacqueline from the University of Montana, partnered with Dr. Bell, who I feel fortunate to be able to work with in that pair. Go ahead and go forward, Lori, please. Okay, so how do we deliver it to our students? So paper, the old-fashioned way these days, or electronically. So, a lot of my students prefer that method. It is based on an actual patient encounter, and then it was modified from there. The idea is to, I'm super, my favorite part of my day is having these students in the clinic with me. So I should remind you too, I'm in a 4-to-1 model. And part of that is just, seeing them grow and facilitating that growth. Part of that for me is for them to be able to grow, they need to be able to identify how do they think. And so that's really where I was trying to go with this as well. And then with it, giving them pieces of information as you get them in the clinic, right? So I see someone on my schedule, I might have a diagnosis there. So I start processing that. And then I get their patient intake paperwork. I start processing that. And then and then as I see them, as I get subjective, as I do objective, and then having the students respond to that. You can go to the next. Okay. So again, really just synthesizing the data that they're getting, and then why they've decided that. And then when they get new information, are they still on, have they changed their mind from their initial thought process? Or are they going to stay with it, and this is why? And then what are they learning about themselves and how they reason through this? You can go ahead and go to the next slide, please. So the CI can just have it available and give it to the student. You can send the students with it in general. They can complete it anywhere. And then either do it independently or collaboratively. If they have, again, like in my case, in that 4-to-1, they can do it independently and then review together, or they can, work on it together as well. I would also say if you're at a facility where you have other professions available, like students, if you have like students of OT and such, it could be something that they could collaborate on as well. I would imagine that they would still be engaging their own thought process with this, or getting feedback about what else do you think could be done here. And then reviewed. So, talking about, I know that Dr. Bell talked about whose time is it going to take. So it can, again, make it fit. I guess my take home message with this tool is make it fit your style, your needs of your, of like where you're at. So please feel free to adapt it in any way. And I would take any feedback you would have, because right, I want to grow too. So if you have feedback for that. So again, the CI varying level, DCE, none, unless you want to hold on to this and pass it out to students in other ways. And someone asked me in the last group, could it be used for remediation? Maybe as a DCE, you're holding on to this in case it could be useful in that way. So you can go to the next slide, please. So far, and again, mostly just because I only work with second years and third years in the clinic for 2 afternoons a week in that 4-to-1 model. And so right now I've only ever used it with mid to terminal level students. Based on the complexity and the level of critical thinking through some of the, through the case, I would probably stick with mid to terminal students. You might find though that you try it with like a, you know, a more someone greener in the program and see how it goes with them. But I've only ever used it with mid to terminal. And in the different settings it could be used in, I think it would really be something you could use anywhere to engage, you know, the student's thought process, because it would benefit them across all planes of practice where they're going and what they're doing. You can go ahead and go next, please. So in the chat, not sure if it's there yet. Oh, yep. So my resource link, Katie put it in there in the chat. So please, you know, feel free to download that and have it and use it. This is just an example of that first page. So the patient actually came in for a consult, and then later on I brought them in for an evaluation. And so again, this is all the information you get. What are you going to do with it? Like, you know, do you just freeze, or do you start thinking like, you know, first of all, what's the purpose of a consult? And how does that actually impact? How's that going to impact what I do with them? And so, and maybe how you communicate with them too. So, and then, you know, why they're determining like the questions they want to ask and what the different measures would tell you as well. Can you please go to the next slide? So they're at number 6 through basically number 9 is really going back to that consult idea of, you know, what is your recommendation going to be? Do you suspect, you know, what would trigger you to send them to the doctor, neurologist? What would you, you know, what would trigger you to say, hey, you need PT, or you know what, here's just a home exercise program, and then be on your way. Check in with me if, you know, nothing improved, if nothing changes. And then number 10 and 11 is kind of carried throughout the tool, asking them like, what did you learn about yourself? Did you get stuck? You know, was something easier or harder? Why or why not? Again, trying to get them to think about how they think. At the very end of the tool, it does ask, you know, for feedback from the student about the tool itself. You can go ahead and go to the next slide. So, okay, so that's the end of that information, but let's see. Oh, I just lost my thought process, sorry. It'll come back. So I would take any questions. I have used it in a couple different, that's what I was gonna say. So I've used it with 3 different student groups to help help like modify it. And I will probably continue to do that as I use it. I'm someone who does not like busy work. I don't want the students to feel like this is just something to keep them busy and that they're not, you know, benefiting from. And so that was really important to me too with this tool. And so in, you know, going over this with the 3 sets of students that I've done it with so far, you know, asking them, and I would like to think that I create an environment in which they feel like they can be honest with me. And none of them ever felt like it was busy work. They really found it useful and beneficial to them in their own growth. I've also used it where, because of how things landed with COVID, I ended up with quite a few extra students in the clinic on a couple of occasions where I was busy the entire afternoon with you know, the different students throughout. And so there was a lot of downtime for these other folks. And so I gave it to them to do independently, and then asked either they do it together or independently and then review it with each other. Because I never ended up having the time to go over it within the course of the time they were in the clinic. The other 2 times, I'm fortunate enough that the 2 afternoons. So from 1 to 6, I get to, I really dedicate that time to my students. So if we have downtime, we try to, you know, work on things that they have their goals for, but also, you know, we've reviewed this measure as well, if we've already covered those other things. And so that's how I've used it. I would say real quick, just for some reference, I am able to, in that afternoon, the first half hour is precepting time, where we go over their plan for the day. And then the last half hour of the day, we wrap it up. So talking about how things went, the students provide each other feedback, and then I provide feedback based on that conversation, just a reference of what we're doing.
Jacqueline, there's oh, sorry. I was just going to say there's a comment or question from Carol Beckel. And Carol, I don't know if you want to unmute and ask your question, because it's a good one, just around using the case or the tool in a different way.
Sure, I just didn't want to lose it. Jacqueline, thanks so much for your presentation. It sounded like these are pre-generated cases that you and other clinicians have developed. Is that correct?
No, I developed this on my own,
Okay.
From a patient that I saw.
Gotcha.
And
my thought was, have you ever thought about flipping it around? And for those older students or advanced students, do you think this would work also to have them generate a case to kind of almost do the reverse working of it? To get
I love that idea. I think that's great. Yeah, I think that I'm writing it down.
Good. No, I want you to try it because you're established with this tool. I'm just thinking about different ways of using it.
No, I think that's great. You know, creating a case and what they need, what would they, how they would process and put it down. I think that is a brilliant idea. Yeah. I would also say, just based on some questions earlier, this is based on my style, like the clinical reasoning questions and throughout. This is based on my precepting style. There's no I didn't go out pull some format from somewhere. More of how I engage my students through determining their plan of care. What are you going to do next? What did this mean? And so it's really based off of my precepting style. So yeah. Again, I will take any feedback anybody has on this, and my contact information should be provided, I think, or
It will
give it up to everybody.
Yes, yeah. Jacqueline, at the end, we'll
okay.
Let everyone know where they can access this. That was incredible. Thank you for that. And while people are coming up with more questions, I just wanted to say, it sounds like you work in a dream world. I mean, I can't even imagine to have that amount of time, and you have dedicated time. And yes, you have to if you're hosting 4 students at a time. But it sounds like a dream, and wow, good for you.
Right. Well, and I understand. And again, that's where with this tool, if you're working in acute care, which I have done, I've worked in a number of settings. And, and it's those fast pace on the go all the time. You might not have, the luxury of being able to really sit down and go over this. And so knowing that you can give it to them to work on independently, I have thought, kind of Carol, back to what you were talking about too, is, taking this tool and providing almost a document that helps guide them a bit more. And so if you don't have time, they have something to reference that would help them. And so that's probably something I'll work on this summer, actually, to kind of try to marry those a little bit more, give them a bit more feedback. So, yeah.
We have a comment in the chat from Kara Musa, and she says, I love how this unpacks everything. I think is very powerful, and that it solidifies the value of content knowledge and why it translates to clinic and patient care. Very nice.
Thank you. That means a lot.
Other questions, other comments? I think we have 5 minutes, so.
Jacqueline, have you used this or found it useful don't know how I'm asking this question. Have you found it useful when you're working maybe with a student that's struggling, or can you speak to a little bit to that experience of how it kind of helps in that situation?
Yeah, I would, you know, I've so far, I have had one experience we won't get into, but we don't have time for that today. But, you know, our students come through us sometimes at varying levels, although right there in the same cohort. And so, you know, for an example, actually going through this with those 3 different student groups, my first group, you know, very, very strong group, you know, and they were able to get to some of those places a little bit faster. Whereas I've had a couple other groups that weren't quite at the same level. They were on track, but not, you know, to the degree of those other students that I would say that were advanced, but it still engaged them. But it also worked for the students that were on track and was able to, you know, has been able to help them as well with their, you know, their growth in that area, which again, my goal is to boost them to that next level from where they are starting at when I see them. And so I think that this tool allows me to do that at the varying levels that I have seen so far when they come to me. So
Yeah,
that's a good question.
I can imagine that it helps you on both ends of the spectrum as a CI kind of determine how do I need to meet the level of the student, maybe if they're a lower level or, you know, earlier learner, but also that exceptional student, how can I challenge them even more?
Mm-hmm. And also to know too, like some of the students don't know some of the content that's maybe in there. And so being able to introduce them to some of that. So, yeah.
That was a question I had, Jacqueline. When you are talking about hosting 4 students at a time and using this tool, do they ever work collaboratively with each other to come up with?
Yeah, yep. So it can definitely be used in that way. So they've done that, and then I've come in and then we've chatted about it. And we've also just gone over it together at the same time, where they're all like, I make sure each of them answers. There's not one person that gets to, you know, get out of it by any means. Everybody has to join in, and then and I engage each of them where they're at. So yeah, or, you know, together, and then I harass them all. So yes.
Great. I think we are just about out of time, and I think, will we automatically go back to the big group?
I think so. I think we'll eventually just be beamed up by Scotty somewhere along the line here.
Yeah, Tana just said she's closing the rooms in 1 minute.
Yep. Well, just thank you everybody for being here, and yeah, it's a new experience for me. So thank you. It was very pleasant and I enjoyed it a lot.
Great, Jacqueline.
Yeah.
Great. I think they did too.
There's a question from Carolyn about understanding the NCCE organization maybe, and I'm wondering if that's going to come into larger group around just next steps, or.
We will talk about where you can access what we just did, and we'll talk about some of the events coming up. So I hope that will answer questions, and we can take some questions then too as well. And yes, Matt, where's your background?
I am having the hardest time changing them for this. And I made Lori do this, right? We were going to look like we were leaving the Oscars and just celebrating and cheering.
We did leave the Oscars. It was wonderful.
Yeah,
I mean, what about those presentations? These NCCE members have given us quality products. And I really want to say that the key word in that sentence was given. They gave this to us as a group. And I want to highlight that one of the objectives of the NCCE, and you can go right now to our website and see this, and I quote, one of our objectives of the NCCE, cultivating a national infrastructure to support efficient and effective sharing of clinical education information resources to advance a collaborative culture of quality clinical education. I mean, right? I have the goosebumps right now because wow, we just did that. I mean, for real, in person, well, in virtual person. So a couple more things. We have all kinds of things happening here.
To throw you off there, Lori, I shared my screen.
That's quite all right. Really, what I wanted to say is, yes, that helps, is that what you see on this last slide is, well, before I get to this last slide, what I wanted to tell you was that not only, you know, was it cool to see this in person and with the PowerPoints and the live presenters, but you're going to be able to access this product. Not only the PowerPoint, but the material that they were referring to and that they wanted to use, and some of you couldn't do that. You'll find both the PowerPoint and their tools on the ACAPT resource repository. So go to the ACAPT website and you'll be able to find this on the resource repository, as well as on the ACAPT YouTube. Okay, so who knew ACAPT had a YouTube channel? Well, ACAPT has a YouTube channel, and you'll be able to find all of this there as well, or at least the live presentations. What I would also like to mention on this slide is that we have a few things coming up, and we really want to make sure that you hear it first if you haven't already. On May 20th, a Thursday from 6 to 7:15 Eastern Standard Time, ACAPT will be presenting contemporary legal issues in physical therapy clinical education. Okay, so that is May 20th. And then just 3 short months from now, on July 20th, we will be from 3 to 4 p.m. Eastern Standard Time. I think that's a little early for happy hour. Did I just say that? Anyway, the NCCE will be presenting our second resource sharing webinar. And yes, this was our inaugural resource, and in 3 months we will have our second one. And here's where you can get really excited, you guys, like the people behind me on my screen, because any of you here today can share a resource with this group of peers. And we want you to know how easy it is. I mean, our 2 speakers, they're pros, but I bet you could email them and they'll tell you that it worked, how they were able to do it so flawlessly. And I know that all of you out there involved in physical therapist clinical education have something that you've created, whether it's on paper or it's still in your head, in your mind, for student learning or absolutely anything ClinEd. So please contact us. It's easy. We want you. And Matt,
I love it, Lori. It sounds like a phone-a-thon. I love it. That's it, right? If we want this resource sharing to exist, the people on this call are the people that have that information. So don't sit on your laurels. If there is something that you have that you think you can bring to the group, we sent our contact information to that chat. Connect with Lori and I. We would be happy to walk you through this process. And if you're looking to kind of shine some light on a program or shine some light on a clinical setting, this is a great opportunity to take this literally to the national scale in a 1-hour lunch meeting. This is fantastic. So use it as a resource. Push yourself to share and connect with Lori and I in any way that we can help. We happily walk you through this process, and we are eager for many, many more of these. So I think, Lori, right? I think we made it to the finish line. We're like 1 minute over. We somehow crammed a lot of information into 1 hour. Thank you, everyone, for taking the time out of your busy schedules. Thank you so kindly to Jacqueline and Jennifer for sharing your resources and putting yourself out there. Much appreciate, and do connect with us or any member of the NCCE board any way that you can. We're happy to help you.
Thank you.
All right. Thank you, Lori.
Thanks, Matt.